All right. Take 2. All right. Hi, my name is Logan Geruso, and today I'll be talking about hypertension or high blood pressure and what clinical exercise professionals need to know about testing an exercise program for people with this condition. What is hypertension? Hypertension is basically when someone's blood pressure stays too high over time, usually defined as 130/80 or higher. The scary part is that it's often called the silent killer because people don't always notice symptoms. Almost half of adults in the US have it, so it's really common. If it's not managed, it can lead to heart attacks, strokes, and kidney problems, and even vision loss. All right. Risk factors and complications. There are a lot of risk factors for high blood pressure. Some of them are lifestyle based, like eating too much salt, being overweight, smoking, not exercising, or dealing with a lot of stress. Others you can't control, like age and genetics. Over time, uncontrolled high blood pressure puts strain on the heart, brain, kidneys, and eyes. That's why it's so dangerous. Testing considerations. Before doing any kind of exercise testing, it's really important to check resting blood pressure. If it's super high, like 180/110 or higher, the test shouldn't even start until that's under control. During testing, you want to monitor blood pressure closely and stick to submaximal tests like a treadmill walk, a bike test, or a 6-minute walk test. Maximal testing might not be safe for people with poorly controlled hypertension. Also, watch for warning signs like dizziness, chest pain, or unusual shortness of breath. All right. Exercise programming. All right. For aerobic exercise, the goal is at least 5 days a week for moderate activity, like brisk walking, cycling, or swimming. Which usually means 30 to 60 minutes a day. And it can lower your blood pressure actually by around 5 to 7 points. For strength training here on the right, 2 to 3 days a week is ideal. Focus on the big muscle groups and use moderate weights that you can lift about 6 to 8 times. The big rule is to don't hold your breath while lifting because that can spike your blood pressure. Smooth and controlled movements are the way to go. All right, let me move out the way. All right. Flexibility and relaxation matters too. Sorry, I forgot that part. Stretching, yoga, or even breathing exercises a few times a week can help reduce stress, which plays a role in lowering your blood pressure. And finally, safety reminders: always warm up and cool down 5 to 10 minutes. Check blood pressure before and after workouts. Skip intense workouts as blood pressure isn't well. If you're dizzy, get chest pain, or really struggle to breathe, stop right away or stop immediately. All right. Oops. All right. Summary and conclusion. To wrap things up, hypertension is extremely common. It's a major health risk, but exercise can make a huge difference. Aerobic activity is the most powerful tool. But resistance training and flexibility also play important roles. Safety always comes first, and even small improvements in physical activity can help lower blood pressure and improve quality of life. And then up here, it's just a recap. It's a silent killer. Almost 1 in 2 adults in the U.S. can lead to heart attack. And then exercise helps. Aerobic activity, biggest benefit. Strength training plus flexibility, healthy routine. And then safety, and then the big picture. And then with the right plan, it can lower your blood pressure, reduce long-term health risk, improve overall quality of life. All right. Now for this slide. All right. Things that affect people doing exercise, like physical activity. High blood pressure, diabetes, or arthritis can make people not or can make people want to exercise or feel better, or it can make them avoid it. And then for mind, stress, motivation, confidence, and past experience with exercise matter. If someone feels awkward at the gym, they might skip it. Social, having friends, family, or health pros cheering you on makes it easier to stick with the exercise. But if you have no support, it's harder to do it. And then environment, safe places to walk, cheap gyms, and enough free time can make a big difference. Let me get out the way. All right, what happens when you exercise? Your body changes, lower blood pressure, better heart, stronger muscles, more flexible, better blood sugar, less body fat, and then your mind changes, less stress and anxiety, better mood, more confidence, sharper brain. Social, exercise can be social, group classes, sports, or walking with a friend. Lower health long term, lowers risk of heart problems, strokes, diabetes issues, and just feels better and just feeling healthy overall. And then safety first, everyone's different, keep people going and be professional. And I believe that is the last slide. All right. Thank you for listening to my slide about hypertension.